they further, same laboratory, looked at the effect of coenzyme Q10 on mitochondrial function, and they learned that low levels of coenzyme Q10 reduce complex 1 activity. And recall earlier this morning, seems like a long time ago, that we demonstrated that complex 1 in the electron transport chain is exactly the flaw in Parkinson's disease. That's what was targeted by that environmental toxin, by MPTP, for example, and pesticides. They target complex 1. You protect complex 1 activity with CoQ10. When complex 1 doesn't work, you increase free radical production, which further damages the mitochondria, and recall, that allows more calcium influx. Well, Drs. Beal and Schultz looked at what happens to plasma levels of coenzyme Q10 when you give CoQ10, when you give it. And a large dosage, I think we'd all agree, but look at the increase in levels of CoQ10 by just giving it orally, having people take a pill. And they found that also coenzyme Q10 did upregulate the way that their complex 1 mitochondrial function worked. So here was a direct intervention to target the mitochondria, which has profound implications in the Parkinson's patient. Well, where would we go from here? We're showing in the laboratory that it works. What would be the next logical step? Well, they looked at complex 1 activity and found that after they gave the CoQ10, which is the post-treatment, complex 1 activity works. The call then is, should we be lining up to use coenzyme Q10, published in the journal Neurology? These results suggest that bioenergetic therapies, mitochondrial-based therapies like CoQ10, have a potential role to affect the course of neurologic diseases in which mitochondrial function is impaired and oxidative stress and damage are present. Well, that would be probably any neurodegenerative disease that has a vowel in it. In other words, every neurodegenerative disease that you can think of is characterized by deficiencies of mitochondrial function and free radical production as a consequence of that. Additional research is needed, especially if we're going to be treating people in the early or pre-symptomatic stage of their illness. Well, what is a pre-symptomatic stage of Parkinson's? I mean, what does that mean? You're sort of thinking about having a tremor or, things like, or what's a pre-symptomatic stage of Alzheimer's? Who knows? But I think we can predict who is at risk for Parkinson's by doing hepatic detoxification profiles. And we can predict who's at risk for Alzheimer's by looking at their urine lipid peroxide test, or by looking at their homocysteine, or by measuring their vitamin levels. So we can predict, and certainly we know who's pre-symptomatic. If you carry the ApoE4 gene, you're pretty much likely to be a candidate for Alzheimer's disease. So we should be looking, or at least their call is, future research should look at CoQ10 in terms of getting people on antioxidants before they have brain disease, closing the barn door before the cow gets out. And that's preventing neurological disease. No one wants to talk about it. Do I sound cynical? All right, so what would be the obvious thing to do? The obvious thing to do, if you really want to be exciting about it, would be to identify a group of Parkinson's patients and actually intervene, actually give them coenzyme Q10. What an idea. A non-prescription, non-patentable, available in health food store intervention. And that happened at the University of California, published by the American Medical Association. And here's what they did. They found that those people who got the highest dosage, 1,200 milligrams per day, and I recognize that's a high dosage, but this demonstrates to us antioxidants in brain disease. Their rate of decline on the Unified Parkinson's Disease Rating Scale was 48% lower in 1 year because they took an antioxidant. That's treating the disease. That's not treating the symptoms. This keeps people out of wheelchairs. It keeps people from falling and breaking their hips. It makes them less dependent upon others. This is an intervention that finally targets the fire, not just the smoke. And yet, neurologists have not done this. They give the drugs. Our study, you're going to love this. Coenzyme Q10 treatment at high dosage is safe, it's well tolerated, it reduces the worsening of Parkinson's disease as reflected in the score, and therefore, here's their conclusion, it's premature to recommend it in the treatment of Parkinson's disease. Now, who are they kowtowing up to? Yes, indeed. I think that what happened here, I might not be correct on this, I think the study was probably funded by a pharmaceutical company in an attempt to disprove all of this hocus pocus that people talk about in terms of antioxidants. Well, guess what? It came back to bite them. CoQ10. Drugs deplete CoQ10. Our patients need to know that these drugs deplete coenzyme Q10. Everybody's familiar with the fact that statin drugs, for example, affect HMG-CoA reductase, which is the enzyme necessary to produce your own coenzyme Q10. But it's far more than statin drugs. Which just brings up an interesting idea, an interesting thought. You know, we're real excited about lowering people's cholesterol as much as possible, right? Because that's what we're told. We've got to lower that cholesterol so you could hardly measure it. The Archives of Neurology recently published a study demonstrating that if you're age 70 or over, if you have the quartile that has the highest cholesterol has the lowest risk for Alzheimer's. Okay, we need to repeat that. The highest cholesterol is the lowest risk for Alzheimer's. Cholesterol is not there for pharmaceutical companies to develop drugs to treat it. It's there because it plays an important role as obviously a steroid hormone precursor, but in the brain, cholesterol acts as an antioxidant. Cholesterol is not there for pharmaceutical companies to develop drugs to treat it. It's there because it plays an important role as obviously a steroid hormone precursor, but in the brain, cholesterol acts as an antioxidant. Now, I'm not saying that high cholesterol is a good thing. I'm not saying that at all. But I am saying let's be reasonable, especially when we recognize that the people who've determined what is safe or good levels of cholesterol versus not are getting large amounts of perks from pharmaceutical industries, as we know has happened at the NIH. Now, that was recently published. So they're the ones who set the standard, and they are being compensated by the manufacturers. So I'll let you think about that one. Well, we can damage these neurons with iron plus vitamin C. That will damage mitochondrial function. The control is on the left. When you give the ascorbate and iron, complex 2 activity goes down. But if you pre-treat with vitamin E or idebenone, you see the effect. If you pre-treat with glutathione, what happens? You almost salvage complex 2 activity completely. Here's complex 3 activity, vitamin E, idebenone, or CoQ10. Glutathione salvage complex 3 activity in this very hostile environment of ascorbate and iron in the laboratory. Vitamin E, this isn't news. Vitamin E in cognitive decline in older persons. They looked at the vitamin E consumption based upon a food questionnaire and did cognitive testing after 3 years. 36% reduction in the decline of people who had the highest vitamin E. Complex 5 activity, really affected by very little except for the glutathione. Reduced glutathione is critically important for the brain. So many schemes that we have developed increase glutathione, reducing detoxification load, increasing available sulfur-rich amino acids like NAC, increase brain glutathione. It's known since 1986, 10 years ago, that the brains of Parkinson's patients have a low level of glutathione. In fact, he called his article a disorder due to nigral glutathione deficiency. That was a bit bold. We know there's other things involved. So we know that glutathione does a lot of things. It's also a neurotransmitter. It also displaces that calcium binding from the NMDA receptor, and it regulates the release of dopamine. It would seem that this might be something you should give perhaps to Parkinson's patients. And so many things we can do enhance glutathione. You have it in your syllabus. Reduce challenges by drugs and toxins, and give complementary antioxidants. Antioxidants work in concert. That's why we don't need to give 1,200 milligrams of CoQ10 to help our Parkinson's patients, because the antioxidants work together. Actually, an interventional trial took place in Italy where they gave glutathione to Parkinson's patients and found a dramatic reduction in decline in these patients. Hopefully, we entered into a research protocol, and here are some of our patients as well. This gentleman has Parkinson's disease. He's obviously not moving because it's a still picture, but he's on the regular players. Interestingly, he was taking Tasmar, and here he is walking down our hallway, and you'll notice that he's got some cardinal features of Parkinson's. His feet become Velcro to the floor. Turning 180 degrees is a very big challenge for these people. And you know, what happens is frequently the top part of the body will move forward before the feet can follow, and that obviously will increase their risk for falling. You'll, I believe, see that demonstrated right here. See, his top part goes forward, and the bottom doesn't keep up, and that's why they fall.